to Rethink Healthcare. I'm Tanya. This is Paul.
Hello.
Hi. Today we are going to talk about color therapy. And if we think, we're just going to explore it, and if we think that it can be helpful in terms of rethinking healthcare and improving outcomes, basically.
Outcomes based on color?
Outcomes based on color, exactly. So color therapy is a very well-known and well-researched part of health and well-being. So it's not new for sure, but I'm just not sure that we use it that much in the healthcare setting. So in a previous episode, we did talk about interior design, and we did touch a little bit on color therapy, and you were not a big fan of what I had to say about it.
No, I'm not.
But color therapy, like I said, color therapy is well researched, and it can definitely have an impact on a person's interior, the way they feel inside. So, and therefore,
give me an example.
So, for example, blue can be used for relaxation and.
Okay.
Yeah.
I agree with that. Remember, I think in the last episode I talked about
having a blue,
like a light blue ceiling,
right?
Kind of like emulating the sky,
right?
So okay, I agree with that. Let me just my screen is going blank.
Yeah, and I have some notes here too, because I don't necessarily have this memorized. Blue is definitely calming, but it can be used to, and we can just go through these colors one by one. So blue, we're starting with blue. They use chromotherapists. Apparently,
is that the real term?
Yeah.
Okay.
Use blue to try and influence depression and pain. So, it's calming. Darker shades of blue are thought to have sedative properties.
Let me stop you right there.
Okay.
Have you ever treated a patient and says, "Why don't you go look at this blue color?"
Oh, of course, it depends on the level of pain, of course.
But okay, this is so ironic to me, right? When you say, "Are you feeling blue?" Right? The term, I'm feeling blue today. Are you feeling depressed? Now you're gonna say blue is a treatment? That's such an oxymoron.
Yeah, it kind of is, but
right?
But still, I mean, the research is out there.
I don't
and so it's not meant to be the only treatment for something. It's meant to augment treatment.
But where did the feeling blue and the association with the color come from?
I don't know.
Okay, that's the point I want to bring up.
I don't know.
All right, let's move on with blue. I mean, I like blue, like I said. I like it under, it's actually probably my favorite color, if you ask me.
Oh.
Do you have a favorite color?
Not really.
No?
Depends on what we're talking about.
Okay.
Yeah, I don't actually.
All right. So we like blue. It could help with depression. I don't know. All right. What's the other color you want to talk about?
Green.
Okay. Verdant.
It's color of nature, obviously.
Yes.
When you think of green, you think of nature. It is also another calming type of a color.
But here's the thing, though. For Americans, when you think of green, money. It's greenback.
Okay.
You're wearing green earrings.
Yes.
What stone is that?
It's not a stone.
It's not a stone.
It's glass.
It's green glass.
Yeah.
So what is green supposed to do?
Relax also, and it makes you think of nature, which is calming.
Okay, I
don't see the color green and I think of money. I mean, I understand that it's called green, but that's just because the bill is kind of a green color.
But that's just US based. I mean, for our other viewers outside the country, I mean...
It probably doesn't have a thing. Right.
No, it does actually, because the world currency is pegged to the dollar.
Yeah, that's kind of true.
When they say greenback.
Yeah.
So the dollar backs other currencies. So... Yes, there is some financial connotation to that, but I do agree because it gives you more of like a bucolic feel.
Yeah,
right? The color green.
So in terms of when we were talking about in another episode about the room that you're in, I think greens and blues can be good colors to incorporate into a setting.
Because they're more like nature type.
Yeah, they're calming, they're nature type, they're relaxing, and as the research has shown, it can have some effect on pain.
Okay.
in a good way, that
I
kind
don't
of
know
thing.
about the paint thing.
Well, I'm just telling you what the research shows.
I mean, okay. If my back hurts, I never thought of, let me go look at a color and make me feel better. I mean,
Right.
that doesn't really make sense to me. But
No, but does it make sense to you then that the blues and greens are just sort of natural colors that you might find in a calming setting?
yeah, but I enjoy nature.
I mean, if you look out that window right now, what are the two most prominent colors?
Blue and green. I
Right.
agree with you.
Yeah.
But that's if you enjoy nature. What if you have a teenager who likes black and wants to be in their room gaming? Do you think they could care less about blue and green?
No, not cognate. I mean, you don't consciously think of these colors. They're supposed to emit a somewhat internal response.
Okay, so it's kind of like the environment.
Right,
And the color's supposed to imbue you with a certain
Right.
feeling.
right.
Okay. Okay.
So what do you think of if you walked into a room and all the walls are a bright and deep red? How do you think that would make you feel?
I don't know. I think of blood.
Right?
Like in healthcare,
and okay, so then what does that
who
make
got murdered in here? You know.
Right. So what does that make you feel? Right?
Like you're on fire.
Yeah. So to me, when I see red, I think of anger.
Yes.
Although I think that the research shows that red is actually an energizing color. But if you come into a situation and you already have some anger within you, for instance, you already have that there. I think the red room can make it worse, so to speak.
Have you ever seen a red room in the healthcare setting?
No.
No. Maybe by the reason, but even so, in general, I've seen red accents. I think that that we have. I mean, what does studies show? Like a red car is more apt to being pulled over for speeding,
Yeah, for sure.
right?
I think actually there used to be, if your car was red, your insurance rates were higher at a point.
Really?
Yeah. Yeah. So I never bought a red car for that reason.
I never had a red car. Did I? Let me think. No, I never owned a red car.
And let's think about that for a minute. If it can trigger people who are already a little bit angry, your red car on the road could trigger some road rage.
Road rage.
But in general, in a healthcare setting, I think red is probably a color I would tend to shy away from. Even though in theory, it's energizing, I just don't think I wouldn't, it wouldn't be something I would use a lot in a healthcare setting.
I agree.
Yeah.
I agree. For a change, I agree with you.
What about yellow? To me, that also is energizing and it's happy. Yellow is a happy color.
Yeah, because it's bright.
Yeah.
It kind of brightens you up.
Yeah. Yeah. So I think yellow is possibly a good color to use in the healthcare setting. It's optimistic, it's happy, so what kind of setting would you use that in actually?
I've actually seen these colors utilized in actual color therapy in the long-term care setting. So the recreational therapist will, have a color therapy session with groups, and she would have emit different lights. So I don't know if you call it light therapy. I think it's more like color therapy.
Yeah.
And I've seen her use greens and yellows and blues.
So
I didn't see any red.
We are going to talk about light therapy, and I think the color can definitely come into that because we were just before we were filming, there was a light above us that has a yellow glow to it, and
Let's turn it on and you see.
See,
now we look jaundiced.
now we look a little jaundiced, but what I am saying is that if you have a light and a certain color in a room and it emits the whole glow, then it's more than just something on a wall. It's actually in the air. Actually you're wading through these colors. Could that have an effect on your whatever treatment you're trying to deliver?
I think so. I mean, at least as for us in the healthcare field, colors matter a lot because the color of a person means something to us, just like the yellow. If you have a yellow light in the room and you're evaluating somebody you may think, are they jaundiced?
Yeah, but that's not the setting in which I would think. I wouldn't just have rooms be glowing yellow or glowing blue. I'm thinking more in terms of therapy. You know, you've already done your exam. You know what's wrong with your patient, or not wrong, as it were. And like, for instance, in a mental health institution where somebody's being treated for mania, right? Maybe having a blue glow in the room can help to calm them down.
I would say black. You really want to bring them down?
Yeah, but I mean, you don't want them to go too far. But you know what I mean. Like, so I'm not talking about having, you know.
I get you there. So, you know what? Having said that, I have seen if you look at psychiatric units, actually, if I remember correctly, I do notice a lot of them have blue walls.
Oh, I don't remember that, honestly.
Yeah,
Yeah.
Let me think. I think last week I was in a locked unit, which more like dementia. They weren't really psychotic, but it's more for locked because of safety dementia reasons.
Yeah.
And they had blue walls.
Interesting.
So they were trying to keep him sedate, I guess,
and calm
and calm.
Yeah.
Okay, so I guess the colors. Obviously, we see. I mean, we're assuming you're not colorblind, right? So let's start with that, right?
Yeah, exactly.
We're assuming you're not colorblind, right? So if you're not colorblind, the colors will have impacts subliminally.
Yeah.
Right? But then, as somebody who would use color therapy, they would use colors as an active mode to elicit a mood.
Yeah.
Could it elicit health? I mean, I don't think you can say it could cure or be used to help cure an illness. I think it's more of a mood light.
Yeah, I agree.
Right?
Yeah. I agree. I would think anyway that its only real use is to augment other therapy.
Yes. I mean, in the marketing end, I mean, it's not really our field of expertise here, but in the marketing end, they use color a lot to try and get hooks and stimulate certain thought processes. But also they use it a lot for branding. So from a marketing perspective, they would use same colors all the time.
Yeah, like
because
Coca-Cola being red.
They want that association, right?
Yeah.
But that's in the marketing end.
Yeah.
That's not our realm of what we're talking about here.
Right.
So any other colors? So we talked about green, blue, yellow, red. I guess we talked about black. We talked about orange.
Yeah.
What about orange?
I think is a lot like yellow. So it tends to be a happier color. Depending on the shade of orange, I think it's a more happy color.
But then orange is supposed to be a color that stimulates appetite?
Yeah, that's what I read too. Yeah.
So for like anorexic patients, you give them orange therapy?
Maybe. I mean, I sort of think that, again, it can only be really used color to augment therapy, obviously. I mean, that's an extreme situation, an anorexic person, right?
I think it's more common than you think.
No. I don't mean it's not common. I just mean it's an extreme in terms of health. So, I wouldn't say, here's an orange room, get better. You know what I mean?
Give them an orange. Get your vitamin C and get you some calories.
Right.
You know? No, okay. I never really thought much about orange, but
yeah.
I haven't really seen any orange rooms. I've seen an orange car before.
Don't see orange. Actually, you don't see orange cars very often.
No. But
you really don't.
They're out there. I mean,
black,
they
white,
do stand
blue.
out. Yeah. So
anyway,
is there? Now, these different colors have different wavelengths, right? Mm-hmm. That's how they're emitted. Are there health benefits to different wavelengths when it comes to color? I don't know.
Yeah, I don't know either.
I guess it doesn't really affect.
Yeah, the only way it affects you is at its end point, obviously.
What do you mean by that?
The color that the wavelength emits. ultimately,
Okay.
right?
Well, yeah. So, color therapy. Yes, it's. What's your opinion on it? I mean, is it something that's
Well,
underutilized
I think it
or
goes
no?
into probably underutilized. I think it goes into what we have talked about previously in interior design, and I think that color has a big impact on how you feel when you walk into a room.
Should we use color to interpret a patient's mood?
Well, maybe it's.
You think so?
Maybe.
That's a thought. I never thought about that. You interpret a patient wearing black, or maybe it's probably more if it's a theme that you see him wear all the time.
Yeah.
Maybe that's where
Yeah,
the
but
color.
then I mean, yes,
That's
but
not-
then somebody who wears black all the time, is that really more of a statement of something else, like a fashion statement or a statement based on a group you want to identify yourself with? And
But that could be a thought process
maybe.
because you're consciously deciding what you're going to wear, for the most part, right? You would be able to consciously decide. I mean, if it's in a in a first world country, you have all these choices.
Yeah.
A poorer country, it's just more maybe that's just what they have, and they don't have a choice. But
Right.
so. But again, it's not really therapy per se. But then from the healthcare perspective, we could potentially use color to interpret. Potentially.
Yeah.
Again, these are just hypothetical thoughts.
Right.
Anyway, I'm done with this color stuff.
Okay. All right.
Unless you have
Well,
more to say about it.
no, I don't think I do.
No.
Well,
Okay.
we'll probably touch on it again at some point. But thanks for joining us.
Well, you're wearing blue, so what are you feeling?
I'm feeling calm.
She's wearing blue with some green
I'm just calm all
earrings.
over. Yeah.
So I'm wearing black. Are you trying to? Does this mean I'm
That's not black.
gray? Yeah.
Yeah, it's gray.
Gray. Okay. All right.
All right. Well, thanks for joining us, and we will see you in our next video. Bye-bye.